you face in that unit?
That gets people to adapt to change. And so that is one of the major things we have, especially for healthcare professionals who have been used to a particular way that they do their things, and then you just come and then you want them to do this
differently.
So that change particularly is one of the things that is very, very difficult. And that's why one of the things that infection prevention and control entails is monitoring. You practically monitor people. You know how these environmental health officers are. Yes, and of course when you're doing that, you definitely would have a lot of friction here and there. And then another challenge again we also have is, like I said, apart from the change, we also have child, and that's how we keep training and retraining and retraining and retraining to ensure that people get it. And then of course one of the things is resources as well, because one of the things with infection control is that you put in a lot of money but you don't get money in return. Instead you get benefits like patients getting better early, as you reduce hospital, you get the best treatment, and then monetary.
So much more than money. I'm sure. Yeah.
In fact, that's personally for me, I love what I do, because at the end of the day, balance before the results are out from the lab, and then you already have the lab result, and then you see the doctor who is trying to figure out how to get the result, and then you just tell him, okay, this is the result. Conscious or very ill, just starts getting better. You go the next day or 2 days, and then you see patients smiling, and of course you always be happy. So those are some of the things that, even though it's kind of stressful, but then when you see those, they kind of encourage you, and then they make you want to do better, and then you're impacting lives, and you're also happy doing what you're doing.
And I know one thing with you. I know I've never had any contact with you in the hospital, but from the way you speak, I know that you're a passionate nurse and you just love what you do. So it's just like, re-emphasizing that this morning. Coming back to you, Nurse Jim Job.
Yes, please.
This is the first time I'm hearing of a perioperative
nurse. Yes.
So maybe I would want to know now, who is a perioperative nurse? What do you do? And of course, what's the most rewarding part of your job?
Yes, thank you for this question. A perioperative nurse is the nurse that works within the theater, where we operate patients and take care of their surgical needs. Patient comes in either the medical need or a surgical need.
Okay, it's just that you changed your name. I know it used to be like theater nurse.
Yes.
Okay.
So that's a theater nurse or a scrub nurse.
So you've been given a bigger name and bigger responsibilities as well.
It encompasses the surgery, during the surgery, and after the surgery, the care of the patient.
Okay.
So that's what the perioperative nurse does when it comes to care of the patient. So to ensure that the patient comes in, like she said, safe, without any infection. When we finish the operation, the patient should go home satisfied and not acquire any other hospital infection as a result of because he underwent or she underwent surgery. So that's what the perioperative nurse does.
Okay. And what are those? How has the role evolved? We also asked Nurse Tina about that. And what's the most rewarding part of your job?
Yes.
As a perioperative nurse?
In the past, people used to think that the job of a perioperative nurse or a theater nurse is just to give instruments to whoever.
I thought so too.
No. But no. It encompasses a lot. Patient safety is key to the perioperative nurse. So that's how the care of the patient. His time in the hospital to stay there, and then not just about instrument. It has evolved to a bigger thing that to make sure you see that you are rendering help to the patient, in the sense that he came with a condition, he was treated, he was operated upon, and he went back home safe. Whole and healed from the condition he came in. So that's the most rewarding part of the profession. Okay. Is the satisfaction we get because our patients are treated and they're fine after that. Yes.
Okay, so we'd say, what are you a satisfied worker as a nurse?
Yes, I would say I love my work, but I don't like my job.
Okay.
And that's what informs this year's International Nurses Week's theme.
So what's the difference now?
Yes.
Nurse and a job.
Yes.
The work and a job.
Yes, the job. It's the conditions that are there for you to operate or to work. The working conditions, they are not satisfying for the, in fact, not just the perioperative, for nurses generally, it's not just satisfying. If you look at the work environment, the availability of equipment to work with, if you look at staffing, the nursing profession or the hospitals are understaffed, they are undertrained. You understand? Yes, you don't get people to, management and the government do not invest a lot in the training of nurses generally. You understand? So that makes the job difficult. Then adequate compensation for nurses, whether we like it or not. The economy is not favorable for almost everybody in the society now. So if you don't care for the people who care, you will not get a good outcome on the
good
job.
Results,
yes, good results. So basically, it doesn't just affect only the nurse, it affects the society at large. So because if you come in and you meet a nurse or a perioperative nurse that is not financially, and the domino effect is that you, the patient, will not go back home on time to meet your family, to go back to your business. And so it affects not just the patient, it affects the community at large. Even the student is not satisfied. And they are seeing home costs. The country for driving
every step to and if logical nurses are reach, meaning that even other
not very